Firstly, check the environment is safe and introduce yourself to the patient. Fully explain the procedure and gain consent. Confirm the patient's identity and check if they have any allergies. As the patient has a new wound, complete a pain assessment and offer analgesia as required. Lastly, maintain the privacy and dignity of the patient by drawing the curtains. Once you have washed your hands and cleaned the trolley, gain consent from the patient and confirm the patient's identity, it is now time to prepare the equipment. Perform hand hygiene before opening the dressing pack. Check the integrity of the dressing and the dressing pack and the expiry date and place on the bottom of the trolley. It's now time to prepare the dressing pack. As the dressing pack is sterile, we'll need to ensure that asepsis is maintained. Open the dressing pack by pulling the corners away from you and make sure the pack is completely open. To maintain the sterile field, place your hand in the waste bag and arrange the equipment as follows. Drop all the equipment needed in the sterile field without touching the key parts. Pour the saline into the tray, being careful not to spill into the sterile field. Once the patient and the sterile field have been prepared, it's now time to perform hand hygiene and apply the sterile gloves, being careful not to contaminate the key parts. Using the clean hand and dirty hand technique, clean the wound with a single stroke, covering the length of the wound. Dispose of the gauze right after use. Do not go back over the wound, as this could introduce infection to the wound site. Dry the wound with a sterile gauze. Apply the dressing using the butterfly technique to ensure that the key part of the dressing doesn't become contaminated. Now dispose of equipment and PPE according to trust policy to prevent the spread of infection. It is good practice to reassure the patient throughout the procedure and always ensure that they are informed at each stage. Once the wound care is completed, make sure your patient is comfortable and offer pain relief as appropriate. Monitor the patient for adverse reactions to the dressing and advise them to alert the nurse if they have any further concerns. Finally, ensure that documentation is completed fully and promptly.